Hello, my name is Ashton Corsville, and the following is a video presentation on the challenge of breastfeeding twins while suffering from engorgement. Breastfeeding twins can be initially challenging, but there's no reason not to be successful. The initial challenges while breastfeeding twins can be related to the challenge of feeding two babies, gestational age, and mothers' and babies' health in the early postpartum period. However, another challenge that can arise in the first few days postpartum is engorgement. Engorgement is not specific to moms with twins. It is a common discomfort that many breastfeeding moms endure. Engorgement is when the breasts are so full of milk to the point of looking and feeling very swollen. It is caused in the first few days postpartum due to a hormonal shift after birth, which increases milk production. If engorgement occurs later time in the breastfeeding journey, it's usually the result of poor positioning, poor latch, and infrequent feeding. Engorged breasts present as breasts that are increased considerably in size, can be very tender to touch, very hot to feel, very painful. The skin may have a shiny look to it due to the skin being so stretched. So what could be happening if this is a breastfeeding mom with twins suffering from engorgement? It could be as simple as it is early in the postpartum period and the mom is experiencing an increase in milk production. Or it could be related to the difficulties of breastfeeding twins. Are the babies latching? Is one breastfeeding more effectively than the other? Are the babies premature or small for gestational age? Various factors related to having twins may affect the effectiveness of their feeding. If the babies are not feeding effectively, there will be a lack of milk transfer, which can lead to engorgement. The course of action to treat engorgement will depend on the cause of the engorgement. Therefore, the priority is to first identify the cause of the engorgement, treat the engorgement, and then ensure effective breastfeeding and strategies for future prevention of engorgement. Is the cause of engorgement due to milk letdown in the early postpartum period? If so, the first and most basic approach for engorgement relief is to continue breastfeeding. If the cause of the engorgement is due to poor positioning, poor latch, or infrequent feeding, correct the latch or position and continue breastfeeding more often. A lactation consultant can be helpful in these situations. Any women experiencing engorgement, continuing to breastfeed can become a problem as the breasts are so full that the nipples are flat and the baby has a hard time latching. Many different techniques can aid in milk release to help relieve the fullness of the breast so the baby can latch. These techniques include massaging the breast, gentle hand expression, taking a warm shower, and cold water treatments in the form of ice packs or cold compress. Next, creating an environment conducive to breastfeeding is very important. This involves having the mother find a quiet area, a comfortable position, using rolled up towels or pillows to help support her babies, having water close by, and a support person if needed. It's very important when breastfeeding twins to alternate breasts each feed. Switching back and forth on a regular basis helps produce equal amounts of milk in both breasts. This lessens the chance of ducts being blocked and future engorgement. If the twins are premature and one has to stay in the hospital longer than the other, you can simultaneously breastfeed from one side while you express from the other to keep your milk supply up and continue emptying the breasts. Furthermore, if both twins are required to stay in the hospital, expression from both breasts regularly will provide milk for your babies, prevent engorgement, and treat engorgement if you suffer from it. Nursing support is very important in the establishment of breastfeeding with twins. It can be a very overwhelming experience for mom. Nursing support is also important in the treatment and prevention of engorgement. The role of a nurse can be to provide emotional support, provide breastfeeding teaching and support, teach techniques to aid in engorgement relief, and set up any consultations or referrals that would be helpful for mom. So, as a nurse, what have I learned from this presentation for my future practice? Early establishment of effective feeding is important to help prevent engorgement and treat engorgement if it occurs. The perinatal nurse can play a very important and supportive role. with moms breastfeeding and suffering from engorgement. Breastfeeding twins can be a challenge. When suffering from engorgement, this challenge is intensified. However, with support and effective breastfeeding, engorgement can be relieved in a short amount of time. Thank you for listening to my presentation. I hope you enjoyed.